So good evening all. Good evening. Am I audible and visible? Yes guys, I'm audible and visible. Hi guys. Yes, Srinivas. Yes, Priyanka. Srinivas. Yes, Priyanka. Srinivas. Okay. So how is your preparation, Priyanka? Awais, Kashif, Srinivas. How is your preparation going on? So today is 7th Farre class. And tomorrow we have the last class, the Farre Series, Toxicology Part 2. So how are you? How is your preparation going on? Okay. Yes, Srinivas, good. Good evening. So today's topic is toxicology. So as I said in previous classes, around 25% of the questions in your university exam do come from toxicology. And as you know, toxicology is very vast, and some commonly asked questions are snake bite and agricultural poison like OP poison. So today we are going to discuss about snake bite and organophosphorus poisoning. Fine. So this is one very commonly asked long essay. Name big four snakes. Explain signs and symptoms and management in snake bite. So commonly asked 10-mark question. Okay. So you need to write about big four snakes, fatal dosage, classification of snakes, clinical features, what are investigation commonly done, and also treatment, and about right approach, and about the antivenom and the side effects. So very commonly asked. So Vinay, Solanki and others, fine. Hello. So let's start. So big four snakes in India: common cobra, common krait, Russell's viper, saw-scaled viper. So what you can see here, so this is common cobra. The scientific name is Naza naza. As you know, here spectacle mark is there and hood is there. So whenever you see hood and spectacle mark, it must be common cobra. The fatal dosage around 15 milligram. Very important, 15 milligram. Fatal period is around 30 minutes to 6 hours. Again, a fact-based question. So king cobra, the scientific name is Ophiophagus hanna. The fatal dosage of king cobra, that's around 12 milligram. Okay. Yes. So this is common cobra, and this is common krait. So common krait, one of the most common snake in India. It is most poisonous. If you see here, the fatal dosage is 3 to 6 milligram. Fatal period is around 18 hours. The scientific name is Bungarus ceruleus. This can be asked in Viva. What is the scientific name of common crate? Bungarus ceruleus. Okay, very commonly asked. Then comes is your viper. So this is saw-scaled viper. Saw-scaled viper. So what we can see here, in any viper, triangular head, constricted neck, broad body and pointed tail. Any viper if we take. So fatal dosage around 8 milligram. Fatal period is around 1 to 2 days. And in saw-scaled viper, you will see bird foot mark over the head. Over the head, you will see bird foot mark. तो आपको bird foot mark मिलेगा, ठीक है? Then comes is your Russell's viper. So Russell's viper, again it is viper. The fatal dosage around 40 milligram. The fatal period is around 1 to 2 days. So these four are known as big four snakes in India. The scientific name of Russell's viper is Dubai russelli. Scientific name of saw-scaled viper, Achis carinatus. Achis carinatus. Maranya? Okay, good. So now here, some more extra point in exam you need to write. So what is the classification of snake? What is the classification of snakes? So the classification, it is classified into three groups: Elapidae, Viperidae, Hydropidae. Elapidae, Viperidae and Hydropidae. So can anyone give an example for Elapidae? Elapidae, they are basically neurotoxic. So what are the examples for neurotoxic snakes? Means they cause neuroparalysis, they cause respiratory paralysis and death. Pulmonary edema, froth, hypersalivation and death occurs within 2 to 3 hours. So what are examples for Elapidae? So Vinay, Srinivas, Maranya, good. So it's basically a good answer. Common cobra, CC, and common crate, CK, CC and CK. Then also you can write about mamba and coral snake and coral. So in Viva question can be asked, what are neurotoxic snake? Your answer must be common cobra. Common cobra, common crate, mamba, very aggressive snake, and very silent snake, that is the coral snake. 4 examples. They act on the neuromuscular junction. So they inhibit the release of acetylcholine and they neutralizes the action of acetylcholine that causes neuroparalysis and death. Okay, Elapidae, they act on the neuromuscular junction. NMG. Then vipers. Vipers, the examples are Russell's viper, RV, saw-scaled viper, SSV, pit viper, hump-nosed viper. And most of the vipers, they have triangular head. Again, MCQ, triangular head, constricted neck, broad body, mota आदमी है, ठीक है? Viperidae, so mota soft. So Hydropidae, so basically they are sea snakes. And here some entrance point. So Viperidae, they act on blood. So that's why they are known as hemotoxic. They increases bleeding time. They increases clotting time. And it causes DIC and death. DIC. So disseminated intravascular coagulation. So local symptoms are maximum in vipers. So in case of vipers, you will see blisters, you will see hemorrhages, vesications and all in case of vipers. In case of common crate and common cobra bite, local symptoms are very minimal. So again, this is very important entrance point. Good, CTBT. So fine. Hydropidae, so they are basically myotoxic. Myotoxic. So act on the muscles. They cause muscle necrosis. So especially the muscles of the neck, so muscles of the shoulder. So they cause weakness of the shoulder girdle muscle, like example deltoid muscle, trapezius muscle and all. So sea snakes are myotoxic. So this is the broad classification you need to write in the exam. Then what are non-poisonous snakes? Can anyone tell me what are non-poisonous snake? Non-poisonous. Non-poisonous means they do not cause any signs and symptom. So there can be a teeth bite mark, no fang mark, teeth bite mark, and there will be no complications at all. Can I name one example for? Yes, very good. So rat snake. The rat snake, wine snake, boa. Yes, all these are basically known as non-poisonous snake. Good. So this is about the classification. I'll repeat again. So whenever question asked in exam, big four snakes, so your answer must be common cobra, common crate, Russell's viper, saskeld viper. In exam, you need to write about the fatal dosage, 15 and here 6, it's around 8 and 40. So most toxic is that is basically a common crate. So common crate bite is usually painless and the fang marks are usually not visible. It resembles like stroke. In general, snakes are classified into Elapidae, Hydropidae and Viperidae. You need to write the example and the mechanism of action. And non-poisonous snake, they comes under Colubridae. The family name is Colubridae. And example, rat snake and other wine snake and all usually non-poisonous. Okay, so is it clear, guys? Is it clear? Say yes or no? And scientific name, I said already, Naza, Bungarus ceruleus, Achis carinatus, and that is basically Dubai Russelli. Vipers, they have triangular head. Yes, Srinivas and others? Fine. Chal. Now this is your turn to answer. Look at this now. Try to identify what is this very common snake which causes neurotoxicity and death. So what you can see here, spectacle mark. And also you can see the hood here. And the hood. So whenever you see hood, it must be king cobra or common cobra. When you see spectacle mark, so it is basically that is common cobra, right? Common cobra. Good. So and also look at the scales here. Scales. So in any poisonous snake, scales are large and it completely covers the belly. So it is poisonous. Belly snake, basically belly scales. In non-poisonous snake, so they are either like this. So non-poisonous. Okay. So please write in the chat box. Poisonous snake, single row of scale. Poisonous snake, single row of scale. Non-poisonous snake, 2 rows of scale, and they are incompletely cover the breadth of the belly. Yes, so this is one very, very important point. So common cobra, that's great. Then look at the snake. This snake, steel black in color, which is having a transverse white line. When you see the body, transverse white line is there, you can see here. And it normally travels in night. It has a tendency to bite people in their sleep. It's very cunning snake. It has a tendency to bite people in their sleep. So this is very poisonous, very fatal, one of the common snake. So this is common crate. And also try to understand, common crate bite is usually painless. It resembles like stroke. It acts on the neuromuscular junction. It is basically presynaptic. Try to understand this. Common cobra postsynaptic, common crate presynaptic. And death occurs within 2 to 3 hours. Very poisonous. Okay, good. Painless bite. Maranya, what is your doubt? Yeah, poisonous means single row of scales. Presynaptic, that's okay. Good. So neostigmin do not work. That's great. So Smaranya, good. She's answering from Shushruta batch. So good. She's answering. So neostigmin do not work in case of common crate. Great, Smaranya. Great. Now look at this. My favorite. Motabai. Who is this Motabai? Triangular head, constricted neck, broad body, pointed tail. So what is this snake known as? So this is your Russell's viper. Russell's viper. And also what you can see here, brown spots, black or brown spots, usually 3 rows of black or brown spots over the dorsum of the snake. So this is basically Russell's viper. Yes, thank you, Pakistan. Okay, Aslam. Okay, good, great. Thank you. Okay. Oh no, hood is present only in the living snake, not in the dead snake. Okay, fine. Now look at this snake, and also you can make out here. Look at the tail, guys. Look at the tail. Is it pointed, non-pointed? Can you make out here? Tail in case of vipers, pointed in vipers, rounded in common cobra. Again, this is MCQ. Pointed. Good. Priyank and others, great answering. Good. Chalo. Okay, this is okay. Now look at this snake. This is one more very poisonous snake and very aggressive snake. What you can see here, bird foot mark. You can see something like this. Okay, something like this over the bird foot mark. So whenever you see bird foot mark over the back of the head, it must be saw-scaled viper, SSV. And I said vipers, they have triangular head, constricted neck, broad body. Again, example for Motabai. So saw-scaled viper. Good. Bird foot mark. Now this is your turn to answer. This is again not very common snake. It doesn't come under big 4 snakes. Look at this. This looks like a band is there. You can see the band. Very attractive snake. Okay, it's my favorite because yellow dark band is there. Very attractive, and again it's poisonous. Okay, the brother of common crate. Who is this brother of common crate? Banded crate. Banded crate. Okay, so try to understand the concept. So anti-snake venom provided by Government of India protect only common crate, not the banded crate. If banded crate bite is there, so he is going to die. So that is basically a sad news, right? Banded crate. Good. Now look at this then. This is again big snake and no spectacle mark. Spectacle mark is not there. Very big snake, has a tendency to bite are to eat small snakes like common cobra, and very, very dangerous. It present only in the thick forest, not in the domestic areas. So it is usually in the thick forest. So what is this basically? King cobra. Good. So scientific name is Ophiophagus hanna. MCQ. And one more, look at this viper. And this viper which has something here. Yeah, something like that. So what is this? So this looks green color, and also what we can see here, pit is there. So whenever you see pit, the pit is there. The pit basically for smell. What is this basically? So this is pit nose viper. Pit nose viper. Good. Again, it's not very common. So this is what classification you need to write in the exam. Already I discussed. So hope you understood this, right? So have you understood this, guys? Any doubt in this? Done? Say yes or no. So one part is over. Now we're discussing second part, signs and symptoms and treatment. Say yes sir, yes sir, no doubt. Okay, so your Josh should be very high in forensic class. So always my Josh, my energy is always high in any class since last 15 years. So I request everybody should be attentive, and you should write something in the chat box, so that will keep you awake and keep me awake, and I can give you more and more concepts, and I can teach you in more energy manner. Good. Smaranati, so those snakes, those provides, yeah, fine, yes, no doubts. Atorvastatin, no doubt, fine. Chalo. Smarana, you can note down your doubts, you can ask at the end. So I'll give you around 5 minutes time, so special time, so you can ask. So next comes is your, and one more very important concept. So bit difficult to understand, but you can make out. So this is a snake, so which having a round pupil, and this is third supralabial. Okay, so you can just notice here. So 1, 2, 3. Third supralabial touches both eye and nostril. So it is asked in INICET. Third supralabial which touches both eye and nostril. So it must be, what is this known as? So this is known as common cobra. So all of you write in the chat box. Third supralabial. Whenever word third supralabial in exam, common cobra. Whenever word fourth infralabial. So this is fourth infralabial, largest one. So this is basically common crate. So in common crate, fourth infralabial is largest. And in common cobra, third supralabial is largest, touches both eye and nostril. Now also we can make out here round pupil in case of common cobra, slit shaped in case of vipers. Good, keep writing. So this can be an MCQ in your exam. Good. Chal. Srinivas, that's great. So next comes is signs and symptoms. Very interesting. So what are signs and symptoms in case of snake bite? So this is classical cobra bite or common crate bite. So let's summarize the clinical feature. So one important feature is ptosis. So ptosis is earliest feature because of involvement of levator palpebrae superioris in case of common crate and common cobra both. So there can be dysphagia. So difficulty in drinking water, dysphagia because of the blockage of the acetylcholine action. Dysarthria, So there will be difficulty in speaking. Okay, so that whenever dysphagia, dysarthria is there, probably he is under intoxication. Then broken neck sign. So broken neck sign means the involvement of the neck muscles. So when there's a involvement of neck muscle, so the patient cannot lift his head from the clinical bed. That we call it as broken neck sign. Then in most of the cases there will be hypersalivation. Hypersalivation. So there will be fang mark. Fang mark, especially in case of common cobra, common crate, so they are not visible, are faintly visible basically. Then there will be respiratory paralysis. Respiratory paralysis. Now guys, so what is the finding here? So what is the finding in this patient? Try to answer. Look at the eye. So already there is intoxication. Ptosis is there, and also patient is having difficulty in talking. Dysarthria is there. So most of the signs and symptoms, so they occur within 2 hours. 2 hours. And in case of common crate bite, so common crate, extra point, common crate. In common crate bite is painless. Fang marks are not visible. In common crate, there will be more intoxication. More intoxication. And there will be abdominal pain. This is very, very important. In case of common cobra, there can be convulsions. But common crate, there will be no convulsions. Instead of that, there can be intoxication. Very important. So this is about the clinical features of cobra and crate. Now can anyone tell me what are the investigations done in case of this common cobra and crate bite? Yes, Srinivas and others. What investigation are we going to do in case of this common cobra bite? Investigation, lab investigation we call it as. No, SJ, no, it is not a 20-minute clot test. 20-minute clot test in case of viper bite, not in the common cobra or common crate bite. You are wrong. Recovery of snake. No, that is not possible. Again, there can be some more bite, some more casualties. So don't ask to recover this snake. Okay, so what is that? Very good. So we are going to do acetylcholinesterase level. Okay, so basically we are going to do enzyme immunoassay. Enzyme immunoassay or radioimmunoassay. So you're going to measure the levels of acetylcholinesterase level. Okay, estrase level. So that is very important. Then also you can do single breath count, single minute breath count also. So 1 minute breath count also we can do. So that is about the cobra and common crate. Okay, so now look at this now. This snake bite. So what we can see here. So there are multiple blisters are there. So local symptoms are maximum in vipers. Why? Because viper venom made up of enzymes, very powerful enzymes. So hyaluronidase, elastase, protease, all the kinase and all. So 90% of this venom made up of enzymes. So there will be local symptoms, like example gangrene like this, blisters. hemorrhages, pain. Okay, so viper bite. So the one important is local symptoms. So what are local symptoms? Already I discussed. Second thing, in case of viper bite, so there can be renal failure. So why renal failure? Because of the hemotoxicity, there can be release of hemoglobin. The free hemoglobin that deposits in the kidney, it causes renal failure. Oliguria, hematuria and all. So there can be oliguria, hematuria, there can be spontaneous bleeding. Okay, so there can be circulatory collapse. So all these are clinical features in case of viper bite. Now you tell me, what is the investigation done in viper bite? Yes. Good. Chalo. What is the investigation going to do? So the investigation done is 20 minutes whole blood clotting time. So 20 WCT. 20 WCT done in viper bite, not in case of common crate or cobra bite. Okay, is it clear? Fine. DIC and all the very common. Okay, now this is asked in one of the prof exam. Features of Elapidae bite. Extensive local reaction, hypersalivation, hypotension, feeling of intoxication. So extensive local reaction, that is not there. Hypotension, circulatory collapse in case of viper bite. So either it can be B and D. So answer is B and D. Clear? So both B and D can be answer in this question. So the difference between Elapidae bite and Viperidae bite. So from the standard textbook that is given along with the class notes or PDF notes, just go through this. So this is very helpful. Just go through this after the class. So again, saliva, pupils, respiration, blood pressure, pulse, coagulability and all. We discussed basically the concept. All the facts, all the theoretical concepts, you can just go through the table. So again, if you write this table, you will get distinction mark. So you will get out of 10, you will get 9. Okay. Yes. Now you just identify what are the clinical features in viper bite. Okay, viper bite. देख के बताओ. So what are these clinical features? So what is this? What about this? What about this and this? 4 images are there. What are these 4 images? Just to make you understand. So what you can see here, this is basically hematuria. There is a acute renal failure, very common complication of Russell's viper, renal failure. So this is hematuria. And in some cases, you will see bilateral parotid enlargement. So what you can see here, parotid enlargement. And what you can see here, blisters. Blisters. So blisters can be seen in bone injury. A blister can be seen in scald injury in case of basically snake bite as well, especially viper bite. So that is also a question asked in the exam. Good. So Priyanka and others, that's really nice. So now comes is the treatment. So management of snake bite. So now here there is a patient who is in the somewhere in the village, okay, somewhere in the village, and this patient from Tamil Nadu or Karnataka, somewhere where he was at night time. He was bitten by the snake at night time, and he was going to a toilet. Okay, he was holding, in South India and all, toilets are outside the house. So he was not wearing the slippers, not wearing the shoes. He was just wearing, just going with the, vessel. So suddenly he was bitten by the snake. My question is, what are the things must be done in this case? Yes, come on, guys. Okay, so basically, this is a case of snake bite. So so what you must know here, a right approach. Okay. So all of you write in the chat box, right approach. Right. Right in the chat box, keep writing. Right. What is right we are talking about? So R for reassurance. So R for reassurance. So tell the patient, you don't worry, we are there to help you, and that will decrease the sympathetic activation, so there won't be any fear. And sometimes what happens actually in snake bite, death is caused by the heart attack due to fear. That's why you tell the patient, it is not snake, you don't worry, we are there to help you, like that, reassurance. So point number one. So point number two, immobilization. Immobilization. Okay, so you can immobilize the limb. So up to this, you can immobilize the limb. How? Basically, so you can apply some light wrapping. So we call it as Sutherland wrap. See what happens when you apply the wrap. So that inhibit the entry of snake venom into the deeper vessels and to the major organs. So immobilization should be done, but it should not be very tight. If it is very tight, then it can lead to gangrene, it can lead to loss of the limb and extensive pain actually. So don't do tight immobilization, just do superficial immobilization. We call it as Sutherland wrap. Then comes is G. So G for get to the hospital. So you can take the patient nearby PHC, nearby CHC, nearby medical college, nearby government hospital where anti-snake venom is available. Then, so GH basically get to the hospital, and T for tell the doctor about the signs and symptoms. So you can tell about the signs and symptoms. So like ptosis, difficulty, abnormally sleepy, convulsions, intoxication, so and all. You can tell the patient about the snake also. So sometimes what happens actually, some victim, they bring snake along with the snake bite victim. Okay, yes. So this is what right approach. Okay, that's okay, done. So then the treatment is, next important treatment is ASV. ASV, anti-snake venom. So this is very important. Now before that, can anyone tell me what are don'ts in case of snake bite? I said about do's, what are the don'ts? What are don'ts in case of snake bite? Come on guys. Come on guys. So ASV is given. So in case of mild toxicity, you can give 5 vials. In the moderate, 10 vials. In severe, 15 vials. Again, it is given in standard textbook. At least 5 vials in case of mild. So again, depending upon the signs and symptoms, depending upon the physician. So what are don'ts? I think, yeah. So Smaranya Hatti is telling don't wrap. So okay, tight tourniquet. So don't tight tourniquet. Good. Then some students said, sir, don't do any incision and drainage. Don't do any incision and drainage. No incision, no drainage. Don't do any massage. Don't do any massage. Or don't keep ice packs. Ice packs are in old Hindi movies. Suction, है ना? Don't do suction. So don't do suction. So all these are basically don'ts. Okay. So yes. Good. Good. Many answering. That's great. Now comes as here. What is the side effect of ASV? What is the side effect of ASV in general? So in general, in almost all the patients, so there will be one side effect that is known as anaphylaxis. So what is the side effect? Anaphylaxis. So you can treat accordingly. If anaphylaxis is there, you can treat with the epinephrine or treat with the hydrocortisone and all, anaphylaxis. Then no test dose. No test dose. Then same dose in children as well. Same dose in children as well. And it is polyvalent anti-snake venom. It is basically prepared from horses. Okay, horses. So all these are important points. This can be asked in your viva. Okay. So I'll repeat again everything about keep faith, keep calm. That's okay. Management of snake bite. So I said in the crime scene. So the history is very important. Okay. And you can start right approach. R for reassurance, immobilization, get to the hospital immediately and tell the doctor about the signs and symptoms. Right approach. Iske baad, then you can do ASV infusion, IV. So mild, moderate, and severe 5 and 15. Side effect anaphylaxis, and don't do all these things. Okay. Now cause of death. So what is the cause of death? Can anyone tell me what is the cause of death? What is the cause of death? And what are post-mortem finding? What are PM finding? Again, this is you need to write in the exam. Good. So cause of death, either it can be fear, yeah. So it can be fear. But in case of common cobra, common crate bite, respiratory paralysis. In case of viper bite, it is hemotoxicity. Hemotoxicity. Circulatory collapse. So what are post-mortem finding? In post-mortem finding, you will see fang mark. Fang mark, very important. And also you will see CPC. CPC, congestion, cyanosis, and petechial hemorrhages. So this is about the management of snake bite, the clinical features, treatment, and all. Okay. Yes, good. Good, Maneka Datta, great, all answering. Okay. Now here is a test. You just let me know what is about this test. Okay, this is A and B. A and B. So this is a case of viper bite. And look at the A. So 5 ml of blood is taken in a test tube. It is kept for about 20 minutes. So what is the inference in A and what is the inference in B? Yes, come on guys, A and B. So A is normal, normal clotting, but B that shows DIC. So disseminated intravascular coagulation, consumption coagulopathy. Because of that, so there is no clotting of the blood here. Incomplete clotting, that shows that the patient is at risk of DIC, circulatory collapse and death. You need to start ASV as soon as possible. Good, many answered. So B, Viper bite. So that's great. And look at this image, and you just let me know what are the complications of this tight tourniquet. What we can see here, multiple tourniquet. So multiple tourniquet, what are the complication can happen due to this tight tourniquet? क्या क्या हो सकता है ना? Complication होगा, definitely complication होगा. So what are the complication in case of tight tourniquet when it is applied? तो एक होगा गैंग्रीन, ठीक है, गैंग्रीन होगा, और क्या होगा बताओ? गैंग्रीन होगा, there will be a lot of pain, gangrene. So there can be loss of limb because of the lack of blood supply, gangrene that we call it as. What is the other complication of that? What is the other complication? So one more important complication is when they open this tourniquet in the hospital. When they open this tourniquet in the hospital, there can be sudden rush of venom into the systemic organs, especially the brain and the heart. There can be sudden death as well. So there can be sudden death. So that's why don't remove the tourniquet. So especially in this type of case, immediately in the hospital, you start ASV and slowly you can remove the tourniquet. Otherwise, it can lead to sudden death of the patient inside your emergency or inside your casualty. So yes, then this is what the Sutherland wrap I said. Okay, Sutherland wrap. The pressure should be less than diastolic blood pressure. So it should be less than diastolic blood pressure. So normally diastolic blood pressure is 80. It must be around 50 to 60. So that is the required blood pressure, required pressure in case of Sutherland wrap. Good. Yes, good. So great, SJ. Pressure should be less than 80 milligram. That's great. Good. Now look at the snake antivenom. So this is antivenom, life-saving in case of snake bite. What we can see here, polyvalent. So polyvalent means multi snakes are protected. Enzyme refined. So and equine means horse origin. So most common side effect is anaphylaxis. No test dose is given. Okay. So lastly, the medico-legal importance of snake bite. So medico-legal importance of snake bite. Accidental. So one of the commonest type. It can be homicidal. Sometimes it can be suicidal. And it is also this venom is used also to kill the cattle, used as a cattle poison. So when it enters the bloodstream, it can lead to respiratory paralysis and death. So when snake venom is taken orally, nothing will happen. When snake venom enters the blood, it definitely poisonous. Okay. So good. Many answered Kerala. So accidental, most common one. Homicidal, in case of Kerala murder case, in recent murder case, Kerala murder. Okay. And suicidal, one very famous case is Cleopatra. Cattle poison, I said already. Okay. So this is what I said. Kerala snake bite murder. Husband sentenced to life for Uttara's killing. Uttara's killing. Can anyone tell me why is it murder? Why? What are the two components of murder? So in this case, actually, the wife was killed by husband. So the modus operandi, the method that is used, homicidal snake bite. So basically the motive was insurance money. Insurance money. So there is a motive. So there is a motive. Point number one. So motive is clear. Then he planned. So he purchased, snake from some villagers, and also he practiced how to handle snake. So that is showing pre-planning. So that is basically guilty mind. So guilty mind. Then he kept common cobra. So around the bed of the victim. Before that, so he sedated his wife by giving sleeping pill. So everything planning here. So planning is there. Planning. Then he kept the snake. So that is basically guilty act. So guilty act. And she died. That's why it is punishable under 302 IPC. So some student asked me, sir, what is murder? What are two components? So two components of any murder is mens rea, actus reus. So mens rea, that means basically guilty mind. Actus reus, basically guilty act, that is basically that is keeping the snake around the bed of the victim. So he got double life imprisonment. So not the 14 years, it is around 28 to 30 years, or his entire life must be in the jail. I hope you understood this. Motive is present. So all of you write in the chat box. So murder is equal to mens rea, actus reus. Keep writing. So murder is equal to mens rea and actus reus. So keep writing this in the chat box. So the next comes is your Cleopatra death. You know Cleopatra, one of the famous queen in the history. She died due to suicidal snake bite. So at the around the neck region, neck and thoracic region. So Cleopatra is a classical case of suicidal snake bite. So very rare, but the possibility is there. So this completes your snake bite. So I hope you understood everything about snake. So if you write all these points, so it is very good basically. Smaranya Hatti and others. So all of you guys have understood snake bite? Say yes or no. So we discussed everything. Classification of snake, mechanism of action, fatal dosage, fatal period, signs and symptoms, investigations, and also medical legal importance and treatment. Everything we covered in around 40-45 minutes. So it's very useful, I think, and also right approach. Yes, SJ, Srinivas, Maneka Datta, Maranya Hatti. Yeah, chal. So the next important topic is the favorite of examiner in your prof exam, that is OP poison. organophosphorus compounds. Very commonly asked. Classify OP compounds. Explain signs and symptoms. And treatment. Very commonly asked. Okay. So, OP poison. So OP poison, it is used as an insecticide, it is used as a pesticide, it is also component of nerve gases and all. So it's an insecticide. It is classified into alkyl phosphate, and aryl phosphate. Okay. So alkyl phosphate, one example is malathion. Aryl phosphate, parathion. So you can start like this classification. Then you can write about the mechanism. So mechanism. So very simple. So it inhibits acetylcholinesterase. It inhibits acetylcholine esterase enzyme. So this acetylcholinesterase or cholinesterase is classified into true cholinesterase, pseudocholinesterase. Can anyone tell me where this true cholinesterase is present, where this pseudocholinesterase is present? Yes, guys. True cholinesterase. So that is basically acetylcholinesterase. Pseudocholinesterase, butyl cholinesterase. Okay. So very good. Priyanka answered, sir. True is present in RBC. तो ट्रू होता है इन आरबीसी में होगा. स्यूडो कहां पे होगा? P फॉर स्यूडो, P फॉर प्लाज्मा. तो प्लाज्मा. And also in the liver. Basically in the liver. Okay. So what it will do? It will inhibit acetylcholinesterase level. So that means there is a increased levels of acetylcholine. Increase of acetylcholine. So this acetylcholine acts on the nicotinic receptors. It acts on NM receptor and NN receptor, nicotinic receptor and neuromuscular junction. So it causes multiple signs and symptoms. So basically there will be overactivity of the parasympathetic system. So acetylcholine is a very important neurotransmitter of parasympathetic system. When it increases, so there will be signs and symptoms of overactive parasympathetic system. Okay. So this is what you need to understand. Then, so look at this again, some extra points. Alkyl phosphates, the mnemonic is moth. Moth, matlab death. So what are examples? Malathion, OMPA, TPP, HETP. Fatal dosage, if you see here, 1 gram. But here it is very less. Even 1 drop can lead to death. So in my experience as a forensic expert in this field since last 20 years, one very famous case, the famous case of 2-drop syndrome. Okay, 2-drop syndrome. So we call it as 2-drop syndrome because in one case of accidental death, so there was spillage of 2 drops of parathion or this OMPA over the forearm. So that get absorbed into systemic circulation and causing death of the patient. Even 1 drop can lead to serious complication. 2 drop can lead to death. So all of you try to remember So alkyl phosphate is equal to moth. Moth matlab death. So write this in chat box. Alkyl means moth. So malathion, OMPA, TEPP and HETP. This is asked once in the INICET exam. Good. Keep on writing alkyl phosphate. Then comes his aryl phosphate. Aryl phosphate, the mnemonic is MPDP. MPDP. M for methyl parathion. Parathion, we call it as folidol. Metacid, basically methyl parathion. All is an insecticide, very famous names in agricultural field. So metacid, folidol, TIC20, all is are famous names. The fatal dosage you can see here, 1 drop of parathion. 1 drop can lead to death. Yes, aryl phosphate, MPDP. Good. So now comes is your signs and symptoms. So signs and symptoms, as you know in pharmacology, so the mnemonic is sludge MTF. So it can lead to inhibition of, it can stimulate the neuromuscular junction. So there are some symptoms like this. So sludge MTF. So onset that occurs within 30 minutes to 2 hours. So S for salivation, S for seizure and sweating. So in any case of OP poison, so there will be salivation because of increased activity of salivary glands. So there can be seizures because of stimulation of muscarinic receptors in the brain. There can be seizures and convulsions. Then sweating. So as you know, sweating, neurotransmitter is acetylcholine. So yes, lacrimation, stimulation of lacrimal glands. Sometimes there can be red color tears, which is known as chromodacturia. Red color tears, that is chromodacturia, asked once in the exam. Urination, diarrhea, gastric upset, emesis. There can be meiosis. Remember, meiosis in OP poison, midriasis in datura poison. Tachycardia, there can be bradycardia as well, and fasciculation. So the mnemonic is sludge MTF. So next comes is investigations. Investigations and treatment. And treatment. And medico-legal aspects. MLI. These 3 you need to write in the exam. Good. Srinivas get. So investigation. So you are going to measure the levels of acetylcholinesterase. So plasma cholinesterase. Or RBC cholinesterase. So depending upon that, we are going to classify into mild, moderate and severe. So this is the investigation commonly done. Or RBC cholinesterase level. So treatment, you need to start with the gastric lavas. So now again, the question here is, what is the absolute contraindication of gastric lavas in general? Can anyone answer? What is the one absolute contraindication of gastric lavas? Keep answering. So gastric lavas contraindicated in case of corrosives. Except carbolic acid. Again, very important Viva question, very important MCQ as well. So first thing you can do gastric lavas. You can remove the OP poison from the stomach. Second thing, before that you can do washing of the removal of the contaminated clothes, because it can absorb into systemic circulation. Or you can do clinical examination by wearing gloves. That is mandatory, because parathion and malathion can enter into your blood through the sweat. So it is lipid soluble, that's why. So washing. Then also you can start with the activated charcoal. So activated charcoal is a physical antidote. It binds with the stomach pores and prevents the absorption. The dosage is around 1 to 2 gram per kg body weight. Activated charcoal. Then you can start atropine. Atropine. So what is the dosage of atropine? In case of OP poison, what is the dosage? Can anyone answer, guys? Come on, try. 1 to 2 gram? No, it is not 1 to 2 gram, beta. It is basically 2 to 4 milligram IV. So IV it is given. So atropine is antagonist of acetylcholine. So it is a drug of choice in case of OP poison. So atropine can be given. So till atropinization, till therapeutic endpoint, that is dry secretions of mouth and the larynx. So not the pupillary response, it's a dry secretion of mouth and the larynx and the pharynx basically. So then you can start with the oximes. So oximes are contraindicated in carbamate poison. So diacetyl monoxime is better than prolidoxime. It should be given within 48 hours. So because after that there will be aging and it can aggravate the signs and symptoms, that's why. So within 48 hours. Then also you can give some drugs like diazepam. So basically to prevent convulsions and to prevent some other complications. So these three are very commonly asked in the exam. Okay, good. So that's okay. Now one more important question here is, the which drug reverses muscle weakness in case of OP poison? Can anyone tell me? Which drug reverses muscle weakness in OP poison? Come on guys, come on, try to answer. Not neostigmine. Why neostigmine, beta? Neostigmine, physostigmine. Okay, so if you give neostigmine, physostigmine, so there will be more symptoms. There will be more signs and symptoms. So the answer must be not atropine. It is not atropine. It is oxime. So oximes are basically choline esterase reactivators. So they reactivate acetylcholine esterase or butyrylcholine esterase. So they can reverse the muscle weakness when they are given in time. So before aging, before 48 hours. Okay, oximes is the correct answer. Prolidoxime. Good. So this is about the treatment. MLI. So MLI. So commonly it is suicidal. It's easily available in agricultural workers. So depression is very common. Depression, financial loss, family issues, domestic issues, husband-wife issues. So they tend to take easily available medicine, that is OP poison. So that can lead to death. In my experience, I've seen many cases, hundred of cases of OP poison and death, and some cases I treated also. So most of the cases, no, they will drink 100 ml and they'll come to our hospital. 50 ml of malathion. In some cases though, they drank around 500 ml, they'll come to our hospital. So 500 ml, 100 ml, 50 ml, there is no chance of survival. Even if they survive, there will be serious complication lifelong. Okay. So एजिंग मतलब बेटा फार्माकोलॉजी में है, तो आप एक बार देख लेना. एजिंग मतलब, so the enzyme cannot be reactivated. So that is one very important property of acetylcholine esterase. You can just go through pharmacology. So we call it as aging. So that means it is reversible basically. Good. Maranya, okay. Fine. Suicidal. Then accidental. So accidental, especially in spraying insecticide in the gardens or in the houses. So sometimes it can be homicidal also. Homicidal, but rarely homicidal. So In my experience, it was mixed. OP poison was mixed with the food in a function basically. So in a function they mixed the sambar, we say roti dal. So they mixed dal with the OP poison, very small amount, and many patients presented with the history of OP poison, and we treated around 50-60 patients. So mass presentation in that case. So this is about the treatment and MLI. Then post-mortem finding. So post-mortem, you will see CPC. Okay, you will get kerosene-like smell. So in most of the OP poisons, you will get kerosene-like smell, congestion, cyanosis, petechial hemorrhages, cerebral edema, and all. The cause of death is respiratory paralysis. So this is what you need to write in the exam. So OP poison, the clinical features are splurge, MTF. So signs and symptoms starts within 30 minutes, within 2 hours. Mnemonic is salivation, lacrimation, and all we discussed. And meiosis, tachycardia, fasciculation. And what investigation we're going to do? RBC cholinis, plasma cholinis stress. Treatment is basically gastric levers, activated charcoal. Then you can do atropine. Atropine dosage is 2 to 4 milligram IV till atropinization. Then oxime, prolidoxime, and diacetyl monoxime. DAM is better. So then diazepam also given. So medical legal aspects, homicide, suicide, and accidental. And the postmortem findings basically CPC present, cause of death, respiratory paralysis. So this completes your OP poison. I think if you write all these points in exam out of 5, so what is your expectation? What is your expectation or what is your expectation of marks out of 5? Very good. Sparanahati, prolidoxime is not good because it cannot cross the blood-brain barrier. So DAM can cross the blood-brain barrier. So that's why it is better. 4 marks. Manaka, Smaranya. Okay, that's great. Okay, chalo. Now look at this image and try to answer. What is the finding here? Yes, very good. It is chromodacruria. Chromodacruria. Good. So now look at this. So in any case of OP poison, airway, breathing, circulation, drugs, ABCD is must along with the gastric levers. Okay. So one of the most common long-standing complication is intermediate syndrome. Okay, intermediate syndrome, that is also commonly asked in the exam. So that's okay. Then comes is name some cardiac poison. 3 marks question. Simple. 3 marks question. Cardiac poisons. So cardiac poison act on the heart. So basically act on the sodium, calcium channels in the heart. It can lead to heart blocks. It can lead to bradyarrhythmias, cardiac blocks, and death. So what are cardiac poison? So before that, look at this now. So this is basically pan. So very sweet. Okay, pan है ना. So this cardiac poison can be mixed with the pan. So it can be used as an ideal homicidal agent. So that is basically known as aconite. So cardiac poison, the first one is aconite. So aconite is the ideal homicidal agent. It is sweet in taste. So it can be mixed with the curd, milk, or it can be mixed with the pan and all. Second thing, yellow oleander. Yellow oleander. So that is Cerebera tivacea. Cerebera tivacea. So it has a yellow color flower. That's why yellow oleander. Then we call it as white oleander. So white oleander. So that is basically Nerium odorum. Nerium odorum. Then digitalis. Cardiac poison, which is known as foxglove. Then comes is your nicotine. Nicotine, very common cardiac poison. Then comes is cerebra odolum. Cerebra odolum, so which is known as suicidal mango. So one mango can lead to death of the patient. So all these are basically cardiac poison. If you mention this, more than sufficient for 3 marks question. If aconite is asked, you can write aconite is a cardiac poison which act on the heart, inhibits calcium sodium channel, cardiac arrhythmia and death. It causes hippus. You can write about hippus. So it is sweet in taste. So one of the ideal homicidal agent. It is known as queen of all poison. Okay. So aconite is known as queen of all poison. Queen. So very interesting. So arsenic known as king of all poison. The arsenic queen is basically aconite, that is basically cardiac poison. So please write in the chat box, king is arsenic, the queen is aconite. Keep writing. Come on guys. King is arsenic, the queen is aconite, cardiac poison. Hai? Keep writing guys. Good, Manaka, that's great. Okay. Then aconite root is the most toxic one, which is normally resemble like horseradish root. That is also asked. So this is about aconite. Done. Now this is your turn to identify. Now look at this. This is also cardiac poison. You know, chewing around 20 leaves, 20-30 leaves along with the flower, so can lead to cardiac toxicity and death. Recently, one case noted nearby Kerala, where a girl was talking on phone, and meanwhile she was having the leaves of this plant, and she found dead after 2 to 3 hours. So this is a cardiac toxic. So this is basically yellow color flower is a yellow oleander. Yellow oleander matlab Cerebra tivaceae. Cerebra tivaceae, yellow oleander. Okay. Now look at this. This is the pink oleander. Pink. So this is Nerium odorum. So the active principle is nerin, nereodarin and all. So basically good, pink oleander. Okay, Smaranya, what is your doubt? कहाँ पे हो आप? बस ठीक है. हाँ. Smaranya, see, some books gives 10 to 15 gram, 10 to 20 leaves. So it is not asked commonly in the exam. You don't worry. The fatal dosage of oleander and all not commonly asked. You can write 10 to 15 gram. So that is what you can write. Okay. So Nerium odorum and Cerebra tivaceae. Good. Okay. Now look at this. Try to understand this. Look at this mango, green mango. So this is the green mango, and inside this green mango, so there is a kernel. Okay, kernel matlab seeds. Seeds hoga. So one seed can lead to death. So what is this basically? Green mango. Whenever word green mango, suicidal mango, okay, used in Tamil Nadu, Kerala and other states to commit suicide. So mango is very good, mango is very tasty, but this green mango, it's very, very bad. Cerebra odolum, good. Cerebra odolum. So great. Good. So we discussed so many things. Green apple, good. Apple is good. Torn apple is very bad. Why is this segment? So green mango is very bad. Mango is good. So like that. So then comes his name for plant organic irritants. So again 3 marks question. Sometime it can be a Viva question as well. Plant organic irritants. So bit difficult actually. I'm going to tell you, don't worry. So can write. So like this in exam, 3 marks. So one I remember, so that is basically castor. Castor plant. So R&D plant. So castor oil. So resinous communis. So active principle is resin. It inhibits protein synthesis by inhibiting RNA polymerase. So fatal dosage around 10 seeds. Fatal period around 3 to 4 days. So we discussed in previous class umbrella murder case and all. So resin, castor. Second, rati. Nothing but your Abrus precatorius. Abrus precatorius. So they are very attractive seeds, black and red color seeds. So it is used as a cattle poison, used in suicide, homicide, and also used as an arrow poison as well. So, and also in the abortion as well. Then comes is your Semicarpus anacardium. So which is heart shaped seeds, black color with a projection at one end. So that is also used in artificial brews, also in criminal abortion. Then comes is your calotropis. So calotropis procera and calotropis gigantea. So we discussed many times in previous classes. Then chili seeds. So they are basically capsicum anum seeds. So which can lead to human hand. So the seeds resemble like the datura seeds. So all these are basically the plant organic irritants. Then ergot alkaloids. Some books gives ergot alkaloids also. So which causes Saint Anthony fire and all. So all these are basically plant organic irritant. Croton tiglium. Yes, one more some student answered. Sir, croton tiglium. Okay, so good. Great. So now look at this now. So in exam, the question can be asked like this. So what is this? Look at this now. What are these seeds? This is how it looks. I'll come little near. We can see here. Can you able to see, guys? Clusters. You know, they are in clusters. What are these plant? Let's open this seeds. I'll just open the seeds. Okay. So on opening these seeds, so what I got? So I got. I think it is not visible. You know, this is what somewhat shiny seeds. Okay, shiny seeds. Okay. I think now we can make out. So they are shiny. You know, they are very shiny seeds. Shiny. So basically shiny seeds, whenever word shiny, that means castor seeds. Okay guys, chalo. This is about the castor. Then look at this now, these seeds. No beta, Swaranya, it is not thorn, SJ is not thorn apple. Thorn apple is datura. So this is basically castor seed. Shiny seeds are castor seeds. Okay. What about this? So this is basically Abrus precatorius. So it is used as an arrow poison It is used in homicide. It is also used as a cattle poison. So sometime in suicide as well. So the fatal dose is around 5 to 10 seeds. So it consists of abrin. So it inhibits protein synthesis and causing death. Active principle is abrin, abralin and all. Okay, Abrus precatorius. Great. Now look at this. Heart-shaped seeds. Heart shape. With a projection at one end. Projection at one end. So it is used by laundry people to put a mark on the cloth. So what is this known as? This consists of semicarpal and other principle. So this is used in artificial bruise and criminal abortion. So this is basically semicarpal. Semicarpus. And this is already we discussed. So this is calotropis. Good. Calotropis. So what is the active principle? Calotropin, calatoxin, gigatin. So if it is white color, it is known as procera. If it is somewhat pink color, then we call it as colored. Colored means that is basically known as gigantea. So used in abortion, artificial bruise, arrow poison, cattle poison, infanticide. So many uses. So many uses of this plant. So okay. So this completes your okay. So last question is there. After that, we'll have spotters. Medico-legal classification of poisons. Very interesting image there. So Menaka Datta and others. Priyanka, can you see the nail polish here? Recently, so one case of nail polish remover poisoning. What is this nail polish remover consist of? Nail polish remover. So it was a case of accidental intake of this nail polish remover in a child, in 3 or 4-year-old child who has consumed this nail polish remover accidentally and presented with the kidney failure and death. So what is that present in nail polish remover? Anyone answer? What is this? This is basically accidental poison. So basically it is acetone. Acetone. Okay, acetone. So the question asked in the exam, what is the medico-legal classification? Not the usual classification, medico-legal. So some are used in homicide, some are used in suicide, some are used and causing accidental poisoning and all. So arrow poisons, criminal abortion, abortifacient and all. That is what question asked in the exam. Acetone is the correct answer. Good. So in exam you need to write like this: homicidal. That is basically arsenic and aconite. Suicidal, opium, barbiturate, organophosphorus. Accidental, so like example nail polish, a stone. Baby powder, boric acid. Rat poison, aluminum phosphate, zinc phosphide. Disinfectant, phenol. So all these are basically accidental poisons. In gardens we use DDT. Mercury as a fungicide. Weed killer also. Therapeutic like iodine. Throat tablets basically consist of sodium chlorate. So it was not used nowadays. So nowadays this sodium chlorate is not used. Previously it was used in laryngitis and pharyngitis as a mouthwash. Then comes is your kitchen, basically baking powder. So baking powder that consists of carbonates, matchstick that consists of phosphorus, red phosphorus, fuel oil, all is basically, all these are accidental. Some are cattle poison, like example abrus, arsenic, aconite, nitrates, calotropis, oleander. Some are used in abortion, calotropis, croton, aconite, ergot, arsenic and all. Stupefying, 3 marks question. 3 marks. What are the stupefying agents? datura, cannabis, chloral hydrate. Some other poisons, like example, overdosage of insulin or some bacterial infection. So don't worry about that. So all these are basically important poisons. This is the medical legal classification of poisons. Hope you can write in the exam. Yes, guys, are you able to write? So Smaranya, Priyanka, Manaka, Srinivas, SJ. Stupefying means they cause delirium, or they cause confused state. Stupor, stupefying means confused state. So yes, Maranya. Okay. So this completes your today's session, and now we have forensic spotters. So before that, let's take a 5 minutes break. So a 5 minutes break. After that, we will continue forensic spotters. So, yes, guys, shall we start? So, the last of half an hour, so we are going to discuss some interesting forensic cases, some important 3 marks questions. I hope you are enjoying class. So, this is the 7th Farre Series YouTube session. So, we have one more session tomorrow, the last session. So, ready, guys? Ready? So, how is the Josh, my dear students? How is the Josh in forensic class? Come on, guys. So Josh should be very high in forensic class. So I said in the previous class, should be high. Okay, come on, ready. So let's start. Yes, so now I think this is more of an interactive session. So you need to answer. I'll give you around 20 30-second time. Then I will just help you to remember few facts. So few 3 marks question can be asked in your prof exam. Okay, yes, ready. Good, Prajwal and others, Menaka, hi, that's great. Okay, so now I am in the autopsy room. Skeleton keys to homicide. It's a case of murder basically. So now I am in Shaw Pariksha room. A 40-year-old male found dead in unnatural condition and total body was skeletonized. We found some skeleton, some cranium bone, some limb bone, some lower limb bones and all. So body was recovered after I think 1 month or 2 months. So many thought it is a case of natural death, unnoticed natural death. So during forensic examination, so this was the appearance. Now look at this now. You just tell me, is this normal or abnormal, and what is the finding? What is the weapon probably used here? So dead body was found in a construction site. So he was a male, a 40-year-old, and he was chronic alcoholic, and he was having some dushmani with some people around that area in a remote house. What is this basically? So here what we can see here, I think many answer correctly. Maneka Desa is first to answer. Very good, Maneka Datta. So this is depressed fracture. So also known as signature fracture. So normally it is caused by the hammer, but in this case the weapon used was the bricks. Okay, bricks, very hard bricks. So he was assaulted by some 4 or 5 people. So there was a quarrel between the people. He was assaulted and he got multiple cranial injuries and died. So here the cause of death is so craniocerebral injury. Craniocerebral injury. So the manner is homicide. So punishable under 302 IPC or 103 BNS. So this is the importance of forensic medicine. So in administration of justice. So by looking at the dead body, so you can give some opinion. So it will definitely help in solving forensic mysteries. Okay, signature fracture. So first to answer is by Meneka Datta, M Datta. So great. Now second case. This is also a very interesting case. So all of you concentrate. Now I am in the crime scene. So me along with the police officer, so we are there in the crime scene. So we cannot show real crime scene photos. So this I got it from the website. So here a 35-year-old healthy male and unnatural death. Room was locked from the inside, naked. So this was the appearance. So what you can see here, so the person is naked and he was watching some dirty materials on his phone in front of the mirror. So protective padding. So there was a protective padding around the neck. So then something, game is over. So game is over, life is over. What is this condition? Game is over, life is over. Come on, guys. Good, good, good. So come on, guys. So yes, time is over. So the answer is autoerotic hanging. So what are the features of autoerotic hanging? 5 points. The point number 1, it is accidental death. So accidental death during game. So commonly associated with masochism, sometime fetichism, sometime during masturbation. So there will be protective padding. And it is very common in males. It can be seen in females also. So very common in males. So females also it can be seen around 10:1. So it is common in males, around 10 times common in males than females. And what is the cause of death? Asphyxia and venous congestion. Okay. Good. So the first to answer is given by Priyanka. Beta, who is, I think some students are, what is game is over? So that you can see here, game is over. This is newspaper headline. The game is over. A case of death by autoerotic asphyxiation. That means probably game in the sense, probably masturbation. Okay. Yes, Swastik Sarkar. So clear, good. So next question. So next question, I cannot show you the post-mortem picture because YouTube will not allow it. So YouTube will not permit. So here a banana is there. So a 60-year-old man, died in a bar and restaurant. So died in a bar after having food or while having food and resembling like myocardial infarction. So in the crime scene, what we found, some banana. So during post-mortem examination, we found banana in the larynx. So it is stimulating vagus nerve and vasovagal inhibition. And also we found alcohol. So alcohol can be whiskey or beer, whatever it is. So that is a CNS depressant that depresses gag reflex, everything. So it is mimicking like a cardiac arrest. So what is this condition known as? Okay. So this condition is known as cafe coronary syndrome. So very good. So cause of death is vasovagal inhibition. Okay. vasovagal inhibition. It resembles like MI, commonly seen in old age and alcoholic person. It is a case of accidental death. The treatment is CPR. Okay, so this is what you need to write in the exam. Cafe coronary syndrome, also known as banana syndrome. So all of you write in the chat box. Cafe coronary syndrome is equal to banana syndrome. CCS is equal to banana. Keep writing this so that you will definitely remember. है ना? So keep writing SJ and Prajwal, Priyanka, Maneka Datta and others. Good. Chalo. Then the fourth question. So this is one more unnatural death. Death due to walking behind the tractor. So this is the tractor, we can see here, tractor. So tractor, and he is a victim. So here the victim, so the victim chest is compressed between a pole and also the two handles of the tractor. So what is this condition known as? And as you know, this is accidental death. So what is this, and what are the clinical features, and what are the post-mortem findings? Okay, so this is basically traumatic asphyxia. Traumatic asphyxia. So a case of asphyxial death, trauma to the chest, so which can lead to cyanosis, deep cyanosis, petechial hemorrhages, and congestion of the organs, and death of the person. So in this case, what we found, so this is the crime scene photo. You can see here crime scene photo. So in this crime scene, deep cyanosis present, petechial hemorrhage is present, conjunctival hemorrhage is present, and a clear line of demarcation. So this is classical case of mask ecchymotic or traumatic asphyxia. So I think Maneka Datta answered correctly. Tailgating, okay. Tailgating, beta tailgating nahi hai. Swastik Sarkar, tailgating nahi. Smaranya, yes, you are right. Smaranya, okay. Prajwal, fine. So many answered correctly. Good. So Smaranya Hati. So one of the regular student, hard-working student. So good, great. So the next, there is a funny image. This is from sexual perversion. So here is a male. So male wearing a female dress, acting like a female. Anna. So what is this known as? So we call it as transvestism. Other than that, what it is known as? What is the name given to that? Common in males. So this is known as cross-dressing. Known as transvestism. Also known as eonism. So transvestism again classified into hijras and jananas. Hijras and jananas. So in hijra, so genitalia is absent. In jananas, genitalia is present. So test is present in jananas. Now my question is, How to confirm the gender of the person in this particular case? Come on, guys. How to confirm the gender, the male or female, in particular case of gender identity disorder, in especially dead body. Come on, guys. Dead body. So one is physical examination. Yes, very good physical examination. So, but in physical examination, especially hijra, so there can be no genitalia, there can be, vaginal looking areas also. So, but how it is basically? Gonadal biopsy, very good. Srinivas is telling, sir, gonadal biopsy. You can take the gonadal biopsy. Or SRY gene. So when SRY gene is there, definitely male. Or else bar body. So bar body. Davidson body. Davidson body. Sometimes secondary sexual characters. So all this again circumstantial evidence. So in history, then also you can confirm. So this is many the answer. That's really nice. Good. Then this is one more very interesting scenario. This is taken from the very famous movie, Animal movie. This is again asphyxial death. So it leads to venous congestion, sometimes vasovagal inhibition and death. So what is this known as? Try Smaranya. Okay, Prajwal. So this is classically known as mugging. So what is the cause of death in mugging? Either it can be asphyxia or vasovagal inhibition. Okay, it's a type of strangulation. So have you seen this movie? Have you seen this movie, guys? Yes, Smaranya. SJ, Smaranya Hatti, Menaka Datta. Lot of violence in this movie, okay? Heavy violence. Animal movie. So from director of Arjun Reddy. Good. Mugging. Okay. Good. So bad movie, some are telling, okay, that's okay. So next comes is one more important question. Drowning. What is the cause of death in drowning? So in general, there are many causes. Can I mention 5 causes of drowning? So I'll give you around 20-second time. So what are the causes of death? COD. 1, 2, 3, 4, and 5. Let's see who is going to answer. So just write the question number 7. Then write 5 causes of death in case of drowning. So it can be seawater drowning, freshwater drowning, dry drowning, secondary drowning, hydrocution. Yes, come on. Try yourself. So one common cause is myocardial anoxia. Myocardial anoxia. So in case of seawater drowning, or it can be ventricular fibrillation in case of freshwater drowning. In general, the cause of death is asphyxia. Asphyxia. Asphyxia in general cause of death. In dry drowning, cause of death is laryngeal spasm. Or vasovagal inhibition in case of hydrocution. Or sometime secondary infection. In case of secondary drowning, we call it as secondary drowning, near drowning. All these are causes of drowning. So let's see who answered. Okay. Okay, Smaranya. Yeah. So the answer given by Prajwal. So Prajwal, very good. Prajwal answered. Priyanka also answered. Srinivas only partial answer. You need to give full answer. Maranya, secondary drowning, better. Here the person survive for about 24 hours. Then he will die because of secondary complications, like example, peritonitis, pneumonitis, encephalitis, and all. Okay. Yes. Chalo. Then question number 8. So this is a case of medical negligence. On X-ray, what we can see here, instrument was found in the abdomen or in the pelvic cavity. So my question, what is this known as? What is the name given to this in forensic medicine? So this is basically a case of medical negligence. Medical negligence. And leaving swab and instrument, definitely it is punishable offense. So this is res ipsa locator. Res ipsa locator. The facts speaks for themselves, applicable for civil and criminal negligence. So here application of common knowledge is there. No need of any expert evidence in this case. So here it is definitely a case of negligence from the doctor. Res ipsa locator, very good, many answered. So the first to answer is by Manaka. So Manaka, very good. Great. Then the 9th question. So very famous personality in forensic medicine. So alcoholic surgeon. So what do you remember, or what do you remember by seeing this image? And what is the punishment? So what is this? And what is the punishment? From SMC. So write the question number and try to answer. So this is a classical case of alcoholic surgeon treating the patient under the influence of alcohol. So showing rude behavior towards the colleagues. So what is this basically? So having ganja, having alcohol, so having heroin, so and treating the patient under the influence. So what is this classically known as? What is the punishment that can be given by state medical council? Like example, Delhi Medical Council, Karnataka Medical Council, West Bengal Medical Council. What is this basically? So yes, so this is basically known as infamous conduct. Infamous conduct. So try remember 6 A's. So punishment is, so warning, suspension, or PDS. That is professional death sentence. So removal of name of the doctor from the medical register. So in any case of warning, suspension, PDS, so doctor can appeal EMRB in the NMC. EMRB. So what is EMRB? What is EMRB in NMC? Ethics and Medical Registration Board. Ethics and Medical Registration Board. EMRB. This can be Viva question. Okay, good. So here again answer given by so many students, so many, great. And the last question. So again, this is a repeat from previous question. So this is a case of asphyxial death. A very simple question showing deep cyanosis, petechial hemorrhages, clear line of demarcation, known as mosque ecchymotic. So what is this known as? And also you can see here around the eyes, there is one classical finding is here. So there is a classical finding around the eyes. What is this known as? Yes, so this is known as traumatic asphyxia. So the finding here is migratory bruise. Migratory bruise, we call it as raccoon eye. Raccoon eye, also known as spectacle hematoma. So this is what the question number 10. So many answered. So that's great. So great to see you all, guys. So what is your score out of 10? Out of 10, what is your score in average? Can you reply me in chat box? So this completes your Farre 7. So we started with animal organic irritant, snake bite, treatment and all. Then OP poison, then cardiac poison, organic irritants and image-based questions. So tomorrow we are having one more session. So the last session basically heavy metal poison and datura poison, strychnine poison and opium poison briefly, and along with some image-based questions as well. So that will complete your all important topics. So these 8 sessions, so 100%, there will be many questions around 75 to 80%. So we covered everything with the concept, images, and also a very, very neatly prepared PDF. So if you have time, you can just go through the PDF. That is more than sufficient. So I hope you enjoyed it. Panda eye, good. Panda eye also correct. So this completes your session. Okay, so now doubts session. Aniket, IPC will not be asked. No. Yes, Aniket. So only BNS. No IPC. So only BNS commonly asked, but sometimes some old examiner they can ask you about IPC. So don't worry about that. So yes, so Bolam test and all tomorrow I will teach you. So Bolam test, Bolito test, drowning index, and I remember pelvic X-ray and elbow X-ray. Tomorrow I kept a session for that. So anything about from today's class? Aniket, yes, general management of poisoning very important. Like example, gastric lavas, activated charcoal, indication, contraindications. So what is the name given to the tube, Savage tube, Bose tube and all. So general toxicology, especially gastric lavas, important. Yeah, gastric lavas. So very, very important. It's a basic of toxicology. So except decomponent, yeah, nothing else is commonly asked, like acid diuresis, alkaline diuresis, and all. So that we are going to learn in medicine. So in forensic, though, we will not ask. What is the BNS for infamous conduct? So infamous conduct, the infamous conduct usually it is under state medical council. So infamous conduct under the various sections of medical ethics. So not the BNS. So BNS, then it can be 106 BNS. Now it is not there, 106 BNS or 125 BNS also. So the act endangering life. Okay. So Lochia, yes, Lochia is also important question. Can be a 3 marks question. Again, it's very simple question. So depending upon the color, so whether it is 1 to 2 days, 3 to 4 days, more than 1 week, 2 weeks, and all. So depending upon the secretion, especially in pregnancy, and okay. So treatment you must know, Aniket. Treatment, especially arsenic poison, antidote, ball, snake poison, anti-snake venom, strychnine poisoning, barbiturate. So you must know antidote in general. Antidote very important. So antidotes are classified into 4 types. So physical antidote, physiological antidote, adsorbent, and pharmacological antidote and all, chelating agents and all. So that is also important. Smaranahati, estimation age from bone ossification, what is that known as? That is known as forensic odontology. So from using dentition known as odontology. So age estimation with the help of bones, age estimation with the help of x-rays, and secondary sexual characters. So we discussed in practical classes, you must be knowing. So yes. Cafe syndrome, yeah. Cafe syndrome can be a question. Cafe syndrome, basically infant death. So can be a 3 marks question. 3 marks question, rarely asked. Superfecundation, superfetation, Cafe syndrome, unwanted child with multiple bruises of different ages, packet handle fractures and all, subdural hemorrhages and all. Okay, so that is also can be asked in our exam. So the next best step again, so it depends on the question. So you need to understand the question. Depending upon the poisoning, the next best step is, okay. So Chief Judicial Magistrate of West. CJ means Metropolitan Magistrate. So simple word, Smaranya. Any city of more than 10 lakhs population known as metropolitan city. So more than 10 lakhs, so metropolitan magistrate. So that is the correct answer. So tribadism is also can be a 3 marks question. So tribadism means so 3 people, usually husband, wife, and some other male. It's a sexual perversion. Okay. Yeah. Smaranya Hatti, that is known as caliber. Okay, caliber is also can be asked. So caliber. So the minimum distance between 2 opposite lands, known as caliber in case of rifled weapon. Number of lead balls prepared from 1 pound of lead is known as caliber in case of a smooth bore weapon, that is shotgun. Bone test. What is that bone test? So PCPNDT Act, not very commonly asked, very commonly asked in INICET exam. So PCPNDT Act is basically Preconceptional Prenatal Diagnostic Techniques Act. So it can be a 5 marks question. So basically it is determination of sex of the fetus is a punishable offense. So it's basically sex determination. So it's a non-bailable, cognizable, non-communicable offense. So the punishment can be imprisonment, so 5 to 7 years of imprisonment, cancellation of license of the doctor, and also the fine. Okay. So Menaka Datta, what is undertaker fracture? So undertaker fracture is also commonly asked viva question. Undertaker fracture. Undertaker fracture means 7 fracture. It's a 7 cervical vertebra. So Prinsloo Gordon artifact means the collection of blood in the neck or around the esophagus, around the trachea. So that's a post-mortem artifact. So that is normally confused as a neck injury or some bleeding over the trachea and the esophagus. So that's a post-mortem artifact. So bone ossification test. Mental Health Act, no, not commonly asked. No. So Mental Health Act. So not commonly asked. The question can be asked about Mental Health Care Act. So Mental Health Act is outdated. Now we have Mental Health Care Act. They can ask you about 3 marks question, some new question, some bouncer in some university. Not very important. So Sudarshan is asking, sir, what is cafe syndrome? So cafe syndrome I discussed already. So Royal-Sima phenomena, I think, can anyone answer Royal-Sima phenomena? Acha, Aniket is asked, okay, telling in some universities they asked Mental Health Act is a main question, and the PCP and it is also long essay. So I think that is something very unusual question, not very commonly asked. So what is Royal-Sima phenomena? Some student asked me, what is Royal-Sima phenomena? So Royal-Sima phenomena, it was very common around the Andhra Pradesh Royal-Sima area. So what they used to do, they used to kill a person with the help of stab injury. As you know, stab injury caused by the knife or the dagger, and after stab injury, after death, they used to place bullet inside it. So they just used to place a bullet inside it just to confuse doctors, just to confuse investigating officer. So as you know, when the evidence is weak, the case is going to become weak. So there are chances of escape from the law. So in simple answer, Royal-Sima phenomena is artifact where stab injury, placing a bullet inside it, confusing doctors and the investigating officer. So that is Royal-Sima phenomena. Yeah. So what is choking? Yeah, some student asked me, sir, what is choking? Choking. So good question. See, choking in asphyxia is occlusion of the larynx leading to death. Choking in firearm injury is constriction of the firearm, especially shotgun. Constriction of barrel of shotgun. So normally a barrel will be like this, no? So constriction like this now, choking. So choking is to prevent dispersion of the pellets in shotgun. So primary, secondary markings we discussed in previous class. So primary markings are caused by lands and grooves. Secondary markings are caused by irregularities present over the barrel. Okay, so bullet markings also can be asked. So bullet markings can be a 3 marks question. So bullet markings can be primary caused by rifling, secondary caused by the barrel itself. Secondary markings are very specific, simple. So basically, in university paper, no, you need to write about you need to highlight the medico-legal importance. Okay. So forensic medicine, the importance is medico-legal importance, suicidal, accidental, homicidal. For every question, you can write about MLI. Second thing, so in toxicology, you can highlight the MLI and treatment also. Fatal dosage, fatal period, and you can write definitions and all. Okay, green stick fracture, no, this is not forensic question. Manaka Datta, not forensic question, green stick. So this completes your session, guys. So I hope you are enjoying class. So it is useful also. So this completes your session. It is 8:15. So see you tomorrow with some more. Yeah, OP poison can be suicidal, homicidal, and accidental also. So we discussed it. Yes. ठीक है हाँ. Oh yeah. Yes, Prajwal. Thank you. Thank you, SG. Yes, definitely. If you mention some important cases like umbrella murder case, banana case, examiner will be very happy. Okay. Thank you all. Yes, guys. See you. See you in next class. So thank you all. Yes, thank you, Menaka. Bye. Bye, Prajwal. Bye. Bye. Pranam.